everybody. Today we have the pleasure of speaking with Sean Flaherty, who's a seasoned leader with experience in the Medicare commercial market space. Throughout his career, Sean has held pivotal roles in health plan operations, product development, and strategic partnerships, including key leadership positions at UnitedHealthcare, Kroger, and Sunny Rewards. Among his many accomplishments, Sean successfully led the introduction of 9 co-branded Kroger and Anthem Medicare Advantage plans, contributing to remarkable growth and improved member engagement. He also played a critical role in launching Medicare Advantage enrollment kiosks across 2,000 stores, driving significant membership gains. At UnitedHealthcare, Sean strategically guided the Medicare Advantage growth strategy, helping shape product portfolios and build critical provider relationships that enhanced enrollment and retention. Sean's extensive experience in Medicare growth strategies, value-based care initiatives, and health technology partnerships really gives him that unique perspective on evolving challenges and opportunities in the Medicare Advantage space. I'm super excited to learn from his insights on how digital health companies can navigate the space and what's on the horizon for Medicare in the coming years. Welcome, Sean.
Thank you for having me.
Can you share a little bit about your background and what you think are your most pivotal experiences within Medicare?
Yeah, I'd say first off, healthcare has always been really important to me, especially given an early experience I have with it. My mom was diagnosed with stage 4 breast cancer back in 2005. And it was at a time where I was kind of in the process of going through college and at the same time getting ready to deploy to Iraq. So this was a very tough time in my life, thinking about my mom already being at stage 4 and then having to go through breast cancer alone while I would be away from home for the next couple of years. So the big thing initially was just I was thankful that she had insurance. She had the coverage, the ability to be able to get the appropriate level of care. But I think the next immediate thing was how could we have caught this sooner? And how could we have been more proactive in her care and making sure that we're on top of all those preventative checkups and getting the right thing she needs to stay out in front of something like that. So it was one of those things that was just planted the seed really early on in my mind of the importance of healthcare and how to enable others to be able to access it and understand it.
Yeah, thanks so much for sharing that story. I'm curious, did your mom have commercial insurance or did she have Medicare?
At the time, she had commercial.
Okay.
So,
and what are the differences, I guess, between Medicare, commercial, and Medicaid? And
yeah, lots of differences. So speaking to Medicare specifically, it's your age, so 65, or disability status. And I think that alone, there's a broad range of individuals that qualify for Medicare, and there's a huge difference in the risk profile as it relates to those individuals. And therefore, as you compare that to commercial and original Medicare and Medicaid, there's quite a bit of difference. And I think the biggest thing to me is when you look at the average gross margin across those lines of business, Medicare has the biggest at just over $2,000 per member. It's half of that for commercial, 1,000, even less than that for Medicaid. So the difference in the revenue and the gross margin, it allows for more investment or innovation into technology, into thinking about things differently.
You mentioned the term, and we have so many terms that are complex in the payer space, but you mentioned the term risk profile. Can you tell a little bit more about what you mean by that?
It's just the way that not everyone is the same, right? Not everyone has the same amount of care needs, the same amount of conditions. The way that it runs, that it's on a calendar year basis, right? So you have all of these conditions that you've had in the past, you have to go and see your doctor and be diagnosed every year. So it resets every year. And it's a really important part of an individual's care because it means, me as the consumer, I'm getting the care that I need. I'm making sure that I'm staying on top of all my preventative checkups. And then that the payer has the most accurate view of where your health is at currently. And they submit those codes for reimbursement. So it's an important part of the process, that one that providers also play a big part in that too, right? Because they're the ones making sure that you're coming in to see them, making sure that they're asking the right questions and documenting it appropriately.
Mhm. What would you say are the most important factors that founders of digital technologies need to make note of when approaching Medicare payers?
Yeah, I think that the biggest thing is just the regulations. There's an abundance of regulations. There's always changing. A couple other things that are very different in addition to risk adjustment for Medicare is that there's the star ratings, the quality system that CMS runs, and those measures that they included in that, I think it's around 53, 55-ish. The weightings of those change every year. So this is a program that means they paid out over 12 billion in payments to payers last year alone. So it's a big driver of revenue. So understanding your value prop and how it's positioned as it relates to the star rating program. So for example, a big chunk of that is the patient experience. Making sure that your patients, the consumers, are getting the appropriate amount of care at the right time, and it's a good experience for them. Is a big part of that. So understanding the regulations and how that's changing from year to year as it relates to stars, as it relates to risk adjustment. And then payers are just generally risk averse, right? That if you think of the organizations in especially the big incumbents in Medicare Advantage, they're run in a lot of cases by former actuaries and accountants. So very numbers, quantitative focus, and it's a lot of risk to be able to have to switch from one vendor to the next. So the more that you can de-risk it, the more that you can demonstrate their ROI, the easier of a case you have to make with them. So
there's so many things I want to poke at, and
Yeah.
based on what you said. One thing I do want us to clarify is the difference between traditional Medicare and Medicare Advantage, because we did not touch on that.
Yeah, so traditional Medicare, it covers some of the more basic things like like inpatient co-pays and some outpatient, but it does not have a lot of the additional coverage that Medicare Advantage has. So Medicare Advantage, what you'll hear a lot about is like dental, vision, and hearing. That's it. That's additional coverage above and beyond the original Medicare that it does not have. And then the funding has been like, especially over the last couple of years with Medicare Advantage, the funding environment, reimbursement rates have been really high and continue to improve. This is kind of like the first year where we're starting to see a decline in that. But it has enabled a lot of like, especially patient experience benefits. So you're getting additional money. So for Demi was talking about my work with Kroger previously, we were doing a plan with Kroger and Anthem that had up to $100 a month in healthy groceries. And if you think about it, like really, if you want to take a proactive approach to healthcare, it really starts with like what you're putting in your body. Nutrition is really important. So especially seniors living on a limited budget, it's very difficult to justify buying the organic, buying the healthy food because of how much more that it costs. So this is a way to enable their dollar to go further. So things like that's pretty prominent. It's gotten very popular across Medicare Advantage, but you wouldn't see that in original Medicare Advantage. So.
And can we talk about one special population within Medicare called the dual special needs population? At least in my experience, a lot of founders I work with and we've done pilots with from a peer perspective get deployed in this D-SNP population. They're the most comorbid typically. And when you are asked to prove out an ROI, it's fantastic as a digital company to work in a D-SNP population because you're able to show such huge benefits. But I'm curious your perspective, and one, what is a D-SNP population? And then two, why are these so helpful in the digital health technology space?
So D-SNP, that just dual means you're eligible for both Medicare and Medicaid. And like Demi was saying, we're talking about multiple chronic conditions. So diabetes is a very common one. And I think it's initially there. Now there are different from a Medicaid standpoint. it depends on whether it's state run or not. So there's some nuances there, but I think it's an immediate one where you're talking about the most complex of the complex. So if your solution works there, especially from a total cost of care reduction, cost savings standpoint, it's very easy to be able to employ that elsewhere.
Yeah.
Start with the most difficult. And then from a funding perspective, in Medicare Advantage specifically, a lot of payers, if you look at especially the new plans in Medicare Advantage over the last couple of years, from a funding standpoint, it's been very favorable. And you've seen a lot of payers add more and more of these deep SNP focused plans. There's also a little bit different nuances there as it relates to enrollments. You can sell those each month of the year. There's not like that annual enrollment period that you have in traditional Medicare Advantage, October to December. So there's a lot of ways that it's more flexible in their ability to design solutions, and the funding is just has been more abundant in the population.
And I think the structure of the payment too is a little bit, a lot more toward capitation type models. And so, for example, one space that I work in is called PACE, the Program for the All-Inclusive Care of the Elderly, and that they receive capitation payments, and the PACE Center is responsible for deciding what benefits to provide to the senior population, etc. I'm very curious what you think are the timelines for when a founder should approach a Medicare Advantage plan. You mentioned enrollment timelines. How does the enrollment timeline for a Medicare Advantage membership play into when a founder should maybe approach a health plan and start having conversations?
I think it's just never too early. It's one of those things, like, even if they've already submitted. So the way that it works is that the payers will submit their bid or their plans to CMS for the following year. So they submitted them in June for plan year 2025. So those have already been submitted. They're already fully baked. They're just now revealing those plans to the brokers and all the agents who will be selling them. But there were likely things that they wanted to invest in that didn't have the ability, whether, poor star ratings or just some more like economic headwinds that they're looking at and playing a little bit more conservative, that they may want to table and invest in for following year. So you want to get out well in advance of a year. And it's never too early to do that, especially just to plant the seed in their mind, to be thinking about, especially as CMS is altering the way that the weighting of the measures and where the focus is, payers quickly follow that. So the more that you can be on top of those rules and regulations as CMS posts those in advance, the better.
I think one note I want to make around star ratings, actually a couple of notes. I think one, we've noticed more and more focus on patient experience. And medication adherence is by far one of the heaviest weighted categories as well. So innovations that are targeting those spaces are prioritized typically. And then when I work with my clients around Medicare Advantage, and when we think about the value proposition, stars is a huge part to, if you're able to affect and impact the star ratings, that can have a huge benefit for you and your ability to sell to a Medicare Advantage plan. But also there is a lag, right? There's a lag in when the plan measures what the results are and then packages them and then sends them back to the government. And then for when the government actually makes the payment. So can you talk a little bit about that lag and timeline?
It's basically a 3-year lag. It's the star payment. So there's kind of that year to be able to collect information on that in between, because some of these measures, it's like a 2-year time frame. But again, like, this is billions and billions of dollars. So, and as she mentioned, patient experience has become more and more of a focus. There is a de-weighting of that though in the next year. It was a 4-weighted measure, and at one point during COVID, it accounted for over half of the entire star rating for your age group, that's your group of plans. That's going back down to 2, but there's also some health equity measures
Measures
coming
added.
into place, which are mostly patient experience. So I think they're just trying to find a different way of
Yeah, what's
how to
the right
glue
framework?
these together, right?
Mhm.
Because yeah, it is somewhat of a gamification. Like, and the
Mhm.
big players have gotten really good at this of being able to adjust and in advance position themselves for success with these measures. And CMS is just trying to make sure that they're weighting it the appropriate way that
Yeah.
is right for the consumer. And that's a tough balance for them.
Yeah, and I think the three categories, it was around treatment, experience, health
And then
equity, and outcomes, absolutely. So those are kind of the main categories, and within each one of those, there's you mentioned 55 plus and measures that feed into the overall score that a peer would receive.
Yeah.
Yeah. So when it comes to more immediate things that a digital health technology can affect, because STARS is very important. It's a very big budget item, but I'm curious if there is that 2 to 3 year lag, how much of a priority is it for a payer as compared to some other metrics that a healthcare
Well,
startup could affect?
certainly that's where risk adjustment is really important because it is year to year, it resets every year. So payers are always trying to find ways of how can I get my providers to better engage with my members and asking those right questions of like based on historically what we've seen, this is what you need to ask them about. And then they're also getting creative, especially looking at medications to be able to understand what should they be asking them that they aren't yet, as far as like someone's health status when changing from a human year standpoint. So I think there's a lot of creativity there that payers are looking into, as well as looking at supplemental information. But risk adjustment is still continues to be part of that. There are certain codes that are being removed as part of V28. That's part of the economic headwinds for payers as they're looking at risk adjustment. I think on average is decreasing 3 to 7% over this next year because of those codes being removed. So they're asked to do more with less essentially. So that is a big headwind in addition to the reimbursement rates not being as high as they'd expected. But again, if you any way you can show them that you are making it financially favorable for them, whether it's reducing costs, admin costs is kind of another big bucket. Still very important to the payers. If you're going to be able to reduce costs and improve the experience for the customer, that is a very like favorable value prop to demonstrate the ROI for them.
Yeah. Can you share with us a success story from one of the strategies you led, and what did you do tactically to sell to a Medicare Advantage plan?
Yeah, so I think consultative selling, it's a bit of a different approach, but I think in healthcare, just given how complex it is and it's always changing, I think it's better to position yourself on that. And that's just really asking them questions. So you're getting to know them specifically. And instead of jumping right into the pitch, instead of jumping right into the value prop, you are first asking them questions. And then you use their responses to attach your value prop to. So it's, even though we're up at Medicare Advantage, they're all kind of running after the same thing. A lot of times there's so many different factors at play that might cause them to prioritize things differently. So it's really helpful to know that. And then you just spend a ton of time like in advance of just getting inside their head and kind of working together as a team to be able to figure out what those are so that you're prepared to go after those.
Who are the big Medicare Advantage health plans?
Yeah. So United, number one market share, number two, Humana, Evidence, Anthem, then it's like Cigna. There's 300 plus that at least that I'm aware of, but there's a they're very different too in the way like the big incumbents, CVS is another one I failed to mention, but the big incumbents kind of tend to operate in a certain way. I think what I have found like being on the outside, so spending most of my career in United and Humana, even those two are very different as it relates to their strategy. United, very centralized, a lot of the decisions run out of the corporate office at Towers and here in Minnesota. Humana is very decentralized, and they really look to the markets that have a really good pulse on where consumers at, where the market is at, which I tended to appreciate a little bit more, which is you need to get that perspective because of how well it's healthcare is just so different market to market. But then there's a lot of these like upstarts like Alignment and Devoted too that think about healthcare a little bit differently too. So Select Health was one on the West Coast that I worked with during my time at Kroger, and really refreshing to see when you're dealing with smaller organizations like that. There's a lot less red tape. Oftentimes leads to a better partnership, quicker learnings. You can do quicker iterations of different things, and just move a lot more agile than some of the big payers. Big payers give you a lot of national coverage and interest.
Yeah.
Yeah. But some of those smaller regional payers, especially the upstarts, really help as far as learning quicker and being able to do a little bit more.
Can you share how does one even begin to frame up a pilot experience with a Medicare Advantage payer? Let's say that you are in the conversations with a payer and they're like, great, we love your solution. How does a founder navigate the negotiation, partnership?
I mean, trying to make it bite size, I think is helpful, especially if you're going after a big payer, like de-risking it as much as possible really benefits you. I think another thing too is if you are able to go at risk, if you are to think a little bit differently as far as the contract, instead of like a royalty payment, like what I had been doing previously from this co-branded perspective, if there's a way you can attach it to certain outcomes or measured performance from a star rating standpoint, I think that helps you. And they can help, teach you the way as far as what that looks like from their standpoint. But as much as you can, leaning on what's important to them and then how they're thinking about the reimbursement terms is really helpful because that's where they have the expertise.
What are the different pricing options? You mentioned royalties, PMPM. There's now the PMPM standing for per member per month type pricing. There's the per engaged member per month type pricing, PMPM. There's all types of different models out there. Can you share different types of models and what you've seen as more successful, or maybe are there certain trends in pricing?
Yeah, I think so. From a per member per month, that's by and large, that's kind of what a lot of payers are used to. There is ways you can go at risk potentially. So if you say you carve out a certain population and saying for these members, we'd expect them to hit this from a medication, maybe for example, we'd expect to hit them to hit a 4-star threshold as it relates to star ratings. If they do, you pay us a bonus of X kind of thing. That's more of like a value-based risk type of approach of which is going to be more favorable to the payers than a straight royalty of remember per month in this plan, we're going to pay you X. It's the challenge is tracking that, and the payers have a tough time tracking that. So if there are ways that you can help in that setup, I think that helps too, because for them to be able to parse that out, and then from an operations standpoint, now you're starting to eat into their ROI, and they're less likely to go for something like that.
Yeah, I mean, in my experience, I'm curious in yours, working at one of the largest payers in the US, they have a wealth of data, but when it came to actually looking at the data, analyzing the data, there's very limited resources and it was very tough. Yes, you have so much data and a wealth of data, but getting and extracting those insights was always really hard thing to do, and just getting the resources. I don't know if that was the same in your experience.
I mean, part of it is because United started small too, but they made all of these acquisitions. And it was very hard to integrate all of those acquisitions. So they, I still believe, have several claims platforms that they've been in the process of combining them into one. So it's just very fragmented and not something to be understood as it relates to your part of the relationship too. If there's a way to be able to tie that information together and surface it back to them, because they want more data.
Yeah.
The challenge is, how do you use that data to make their lives better as far as from a payer's perspective, using those insights, and then ultimately to the consumer
Yeah.
or member.
I would say it's so critical for you as founders to extract the insights from the data that you're gathering and then give it back to your customer, give it back to your client and say, here's the success that I was able to create for you, instead of waiting for them to analyze the data and come back to you with it, because you might never even get that back. I'm very curious, in your experience, what are some metrics that you tracked in the solutions that you brought to Medicare payers? What measurements mattered? What metrics were important?
So in the most recent examples where I was selling back into payers, it was about membership growth. So this was kind of during a time when rates were favorable from a Medicare standpoint. So they were investing in as much benefits, plans, growth. It was all about growth, kind of growth at all costs. So that's where we kind of met and patient experience is a big part of that too when it was quadruple weighted. So anything that we could do to show that this is going to improve the experience for their customer and help them grow and stand out. Medicare is also known as like a sea of sameness. So any way you can differentiate, that's a great thing. The problem is, like, it's also a fast follower industry. So you'll see kind of the others like add that service or add that benefit the following year. So it's hard to, you continually have to be thinking about what am I going to add? How am I going to make this better for my members? But it's easy to like try and say, oh, this service and my benefit does a number of different things. Like I could make a case for like 9 different patient experience focused measures that we would make an improvement for. I think oftentimes that can confuse clients a little bit. So it's best to like pick a couple, one if need be, but try not to confuse them and try and make it crystal clear, because they're going to have to go and then communicate this internally and get buy-in. So the cleaner you can make the math, the better.
And a lot of these scores are publicly available, so you can actually see where is a health plan underperforming, and you can, point to that and say, hey, my technology is specifically going to help improve this and this and this measure in these ways. So highly recommend looking up that information ahead of these conversations, and or working with an expert in the space that can help you find that information and then incorporate it into your pitch. I'm curious, what trends have you noticed? What are the key problems that Medicare Advantage payers are looking to solve in the next 5 to 10 years?
Yeah, the big one is that the medical costs are up. If you look at the MLR, MER medical expense ratio for all the payers year to date, I think it's something like 1.8% increase, right? And that was supposed to be the sole.
Inflation, please. What is MLR?
The are exceeding the premiums and payments there. So like costs are up, profits are down. Profits are down 9% there. So, and at the same time, CMS is shifting the weighting from stars back from like the patient experience into more of the clinical, like breast cancer screening, for example, is a clinical measure. So there's a focus getting back to reducing the total cost of care. And it takes time again for these big payers to kind of shift their strategies to be able to address them. So anything from like a care coordination standpoint is particular value right now. Another thing too is just, you think of like the baby boomers, right? They have aged in and now they're starting to increase in age. And what we know from a medical cost standpoint, once they hit that 80 plus mark, medical costs typically are double of what you see in the 65 to 69 range. So those agents. So it just continues to get, and you've got that huge group kind of continuing to age. And all this talk about value-based care and being able to reduce costs just continue to rise. So I think finding appropriate levels of care outside of higher cost setting, keeping as many people out of the ER, for example, is a really important focus. Dispatch health is like a
Mhm.
great example of a company that's trying to provide urgent level care in the safety of someone's home, making care more localized. So there's huge focus on reduction in costs. At the same time, reimbursement rates aren't as high, coming
Mhm.
down a bit. So it's just there's a lot of pressure, and we've got an election year, right, in Medicare. So
Yep.
there's a lot of unknowns, especially heading into this fall, that I think is causing payers to, you've already heard the news of the bigger payers pulling out of these unprofitable markets. They're starting to scale back on the growth. It's not a strategy of growth at all costs
Mhm.
like it has been over the last 5 years. Now it's sustainable growth, and now they're looking more at adding chronic SNP plans, what they call
CSNP, yep.
different DSNP, just focused on a diabetic members with a certain condition that they can provide more custom focused care to them.
Mhm.
So there, there's some changes too, a little bit with like the enrollments. I think some of these chronic plans have a little bit more flexibility as far as enrollment goes. They're starting to tighten down like some of the D-SNP enrollment months too, where it used to be that it was every month. So now they're starting to look at some modifications there. So there's a lot, but majority of the focus is really just costs continue to rise. Haven't found a way to reduce those yet. Need to put emphasis there, and that's where you're starting to see CMS and payers come across the board and start to focus on solutions
Mhm.
that will help there.
You mentioned it's election year. I'm curious what changes during election, like what's possible to change in an election year? What are the main impacts to Medicare?
Yeah, it's more of understanding from like just an overall funding standpoint. There's not going to be an immediate impact. Like 2025 is already baked from a Medicare Advantage standpoint. Those plans have already been submitted. This is probably more the outcome of the election was probably going to more impact the 2026, of which right now is a great time to be talking to payers, but it also adds the uncertainty of it.
Yeah.
So, but like get on the radar because we don't know. Like, either way, you might be able to estimate based on like what's important to them, right? As you think of the different candidates, but um, nothing going to immediately impact what has already been submitted to CMS for planning for 2025. It's just more kind of like getting out in advance of what's to come.
Yeah. Does a digital health tech founder have a chance to actually incorporate their solution in a plan that's going to be deployed next year? Or has that passed already?
Well, yeah, there is still the ability to do that for certain services. From a benefits perspective, it's already passed, but plans can still add on vendors kind of even throughout the year.
Throughout the year, yeah.
So there's still the ability. It only depends on the service value offering, but yeah, there's still a chance.
So that's just to say, if you have not talked to a payer yet, you could very quickly be included, depending on how valuable your solution would be to them. It's not just to say, hey, it's going to be an 18 to 24 month sales cycle, even though that's the majority or the predominant timeline in the space.
And to get feedback to think of like the consultative approach, right? You're asking them questions. They are the leading indicator. It's best to get inside their minds as far as like how they're thinking about these potential shifts. And they're probably scenario planning based on the outcome of the election and what that looks like. So the more that you can start asking them questions and getting that feedback, the better.
What would you say are the biggest challenges that a digital health tech company would face trying to approach a Medicare Advantage payer?
I'd say just being able to weather the regulations, the constant changes year to year, they can fluctuate quite significantly. And I think that really makes it hard for your company because your value, you might have to attach to something else. Patient experience, I guess, for example, of like it being very high or weighted, kind of dropping to 2 what other areas do you impact that you can make a case for from an ROI standpoint for the payer? Having to do that every single year that's a lot.
Yeah.
A lot.
And what does that mean from a product design perspective? Does that then potentially change the product roadmap for a digital health technology?
As far as
If the priorities for the payer change, you've locked in, a contract, but then all of a sudden there's a general shift to a different priority.
Yeah, I mean, that's where it's trying to stay ahead of that. I think, you're going to have to adjust your priorities based on that. It could be, maybe let's say you're focused though on total cost of care. I think that's a great value prop, especially right now, where that probably won't change. Like, we know costs of continually be an issue, and that will be even more of an issue going forward with those boomers as they age. So, yeah, totally depends, but be flexible for sure.
Yeah. How do you see the role of digital health technologies evolve in Medicare in the next 5 to 10 years? I mean, you mentioned an example of home health with Dispatch being a leader in the space, but what are there specific topics or trends that you see a lot of digital health technologies being deployed?
The great news is that healthcare is like decades behind much everyone else. So when it comes to like consumer engagement, so for example, like
you mean we still use the fax machine?
Yeah. Stuff that you would need. But for example, like Uber is now in healthcare, helping people with transportation. It's something that was like very intuitive, easy to use. Think of healthcare and that being the case, it's pretty rare. So companies like that coming into the healthcare space where it has been like maybe these are legacy contracts where they just continually renew and kind of upsetting that. I think there's still a huge problem with transparency and ease of use in healthcare across the board. So companies that are positioned to help there, I think will have a great chance of success. Amazon is another one who just had a partnership with UnitedHealthcare as far as enabling seniors to use their benefits and buy these things like supplements, band-aids, vitamins online and have them shipped to their home as opposed to going into like a Walgreens or a Walmart to get those. So anything that all the stuff that you and I use, on our phones, I think you're going to see more and more of that, especially as it relates to this care in the home and what technology is enabling providers to do, whether it be remotely or just making it more localized in general.
And also caregiver support. I mean, having been a caregiver of actually grandparents overseas and literally them waiting for me or my family to come home. So we would take them to the doctor, right? Yeah. Or them being too fragile to take care of themselves to go to a physician. Or now there's a lot of innovations trying to figure out how do we bring the doctor to the home of the senior and digital solutions. How do we alleviate the need for the senior to have to go on location in a specific venue? I guess what are opportunities that you see for innovation? And you've worked in some very innovative companies. And so I'm very curious when it comes to nutrition, what kind of innovations you've seen or some other creative benefits that you can speak to.
Yeah, I would say, I mean, as far as like what's to come in nutrition, it's genomics. There's a lot happening right now in genomics. It's kind of like the early stage for that. But if you think about being able to impact what someone eats, the diet, I think is like probably the quickest way. The challenge is the payers think about things calendar year to calendar year. So in my experience with that in retail the last couple of years, it's been hard to connect the dots on the total cost of care reduction, especially in a meaningful way. I think over time, as more and more academic studies and this whole like food as medicine movement come along, I think that's where we'll see more of the ability, especially in genomics, adds to that and just making it more hyper personalized. That's kind of the movement you're starting to see in some of the plans with these chronic plans, right? Where you're trying to make the benefit offering as custom as you can to those individuals so they're getting the right treatment and the right care plan.
I'm so glad that you brought up the point about the year-long timeline. Whether you're trying to sell to commercial, Medicaid, Medicare, typically you want to show an ROI within 3 to 6 months. And if it's a year, you're pushing it. And if it's longer than that, then it's going to be harder for you to sell in the space. Can you talk a little bit about why that is? And how significant is the turnover of Medicare members in and out of Advantage plans?
Good question. It all comes back to the bid, right? You're submitting that plan, you're kind of baking all the costs into that year. So it all goes back to that year. And from a retention standpoint, it could be, let's say you have a different contract. Maybe you find a way to make this like a multi-year partnership, right? Where you can demonstrate that ROI and they're okay with that because it's a multi-year arrangement.
Is that common to have a multi-year arrangement in Medicare?
Yes, because it saves them a ton of like legal and paperwork, right? Of just going through that contract. So some of them might be like a test and see, but ideally you get to a spot where it's a multi-year relationship because it takes time too, right? To figure out what works, what doesn't. Usually it's really hard to test that in a year's time. Retention from a Medicare standpoint. So the best in class is like 90% retention. You'll have 10% actively need to go, not factoring in like end of life.
End of life, sure.
But that's like best in class. Some plans really struggle with that, and they'll see like 40%, especially
of their population exit and go to a different plan.
It's even higher than decent. 40% is like good and decent. So
wow.
It's especially these this next year. I think you're going to see a lot more shoppers because of these plans exiting some of those markets. But the good news is, on average, there's like 40 different plans available to the average eligible in Medicare Advantage. So there's a wide variety of plans. And you've seen some more like tech is also kind of been active in Medicare Advantage as it relates to enrollment, because at some point, like if it's just a handful of plans, it's kind of easy as a consumer to talk to with a broker to figure that out. But at some point that becomes too much.
If you've got 40
yeah,
and you've got low health literacy, how you're supposed to assess which plan is the best one.
And who's giving you that advice, like they're reimbursed differently depending on the payer. So that broker can be getting different advice too. So a lot of pressure kind of across the business as it relates to enrollment.
Yeah. Well, I would love to give our audience a chance to ask you some questions. So I welcome any questions from the audience. Go ahead.
To the traditional Medicare versus Medicare Advantage. My understanding is if you get coverage from Medicare Advantage, it's supposed to follow actually some cajoling to get them to do that. But is there a reason to go to one or the other? Including that time frame question.
The question is whether it's better to sell to original Medicare, Medicare Advantage, or is there an advantage if you sell to one to then move to the other?
Yeah, I mean, because of the difference again in margin, I think it's probably easier to make a case to Medicare Advantage before you go to original Medicare. But if it's something that obvious, it really is going to depend. But if it's something that obvious, then I'm sure there's probably a case you made to going the opposite. But I generally tend to think like you follow where the opportunity is, and that's to me would be Medicare Advantage just based on looking at the gross margin and revenue.
Yeah. And in my experience, definitely going the Medicare Advantage route, it's easier. You're more likely to find a plan that will resonate with you because there's such a variety than trying to get adopted by original Medicare. Yeah. Other questions? Andy, go.
So you mentioned that I'll call it the churn rate of payers, or not payers, but people on a particular plan is pretty high for
a lot of these plans. So I'm wondering, are they churning out because they aren't satisfied with the benefits that they're getting, or maybe too expensive? Or I'm just trying to figure out why they're.
The question is, what are the key reasons that lead to turnover of enrollment for Medicare Advantage plans?
Yeah, great question. Oftentimes it could be like a provider network issue. So maybe the doc that you've seen for 30+ years is all of a sudden no longer a network for this payer. I think that's like an
A
immediate
big,
driver.
yeah.
But there's also, just because of the investment, especially over the last couple of years, there's been so many more options that have been added on now that it's like, oh, well, networks largely look the same, but I could get, $100 a month on a grocery allowance here at this plan. So,
Or 200 for a gym over here.
yeah.
Or, yeah.
So it's just been a good environment from a consumer standpoint, but I would say like the provider network one still is one you see like common too.
Well, Sean, thank you so much. I'm curious if there's any last parting thoughts you would like to share with founders in the space.
Yeah, just make sure you're up to speed on the rules and regulations. It's like the biggest thing. It is hard to get inside the mind of the payers, and I think, one of the ways that I still try and stay up to speed on that is Health Tech Nerds has been really good for me, like various Slack channels, especially for startups, to be able to access. So there's a lot of folks in the Medicare space as part of that community that you can use as a reference or a resource. So,
or reach out to us at Akros Advisory. Oh, we've got Sean as one of our experts, so we'd love to connect you. And thank you all for joining.
thank you.